Hi, my name is Anita Chevalier, and I am a manual osteopath here at Avita Health. What is manual osteopathy? Well, it's a manual therapy, so I use my hands, and it is a more holistic approach to solving problems. So if you have a shoulder injury, for example, we look at the whole body, not just the symptoms of the pain that you may be feeling. So we could look at the organs. Quite often liver is associated with shoulder pain on the right side. Or we could be looking at some fascial systems. I do advanced fascial remodeling, myofascial remodeling, I should say, and it's a gentle approach, so it can be really effective for chronic pain or problems that people are having, and they really don't know where the problem stems from. And so I like to have a holistic approach to see, is it the organs, is it the myofascia, is it the craniosacral system? It could be something that could have stemmed from birth, some trauma in your childhood, a fall that you had in your 20s, and it's effective for all sorts of ailments, things that we don't even really think about. Some of the obvious ones could be it's effective in TMJ, so temporal mandibular dysfunction of the jaw. It can be helpful for migraines. It can be helpful for shoulder pain and chronic low back pain. Quite commonly, low back pain can be caused by pulling of the myofascia around our organs that are stuck. It's not necessarily a dysfunction of your organs, but it can be that their myofascia is tight around the organs and it's causing a pull on the back body wall, for example. The craniosacral system is excellent for head injuries, people who have suffered concussions. Once they've been cleared by a doctor to come and see a manual osteopath for craniosacral, then we can work with the cranial bones that have very subtle movement. They actually have their own rhythm, a pulse, if you will, and basically we can tap into that and work with the nervous system to decrease your sympathetic response, which is the fight or flight response, and then engage the parasympathetic nervous system, which is your rest and digest. It's super good for anxiety and depression, and can even be helpful for things like irritable bowel syndrome and constipation. So it's an interesting therapy that uses all sorts of modalities, a manual therapy, that can be helpful for different dysfunctions. Manual osteopathy is different than the doctor of osteopathy, so we have a little less education, still encompasses many of the same things, but we don't prescribe medicine and we don't deliver babies, which is what doctor of osteopathy has. So come on in, try it out, and I'd love to see you.